Welcome back to The Explainer. So, in part 1, we looked at what happens when teeth are too big, too small, or when you have too many or too few. Today, we're going even deeper into the strange and fascinating world of how teeth develop.
Right, so we've got the basics of size and number down. But what happens when teeth decide to change their actual shape, get a little lost on their way out, or just show up at the completely wrong time? That's what we're diving into now.
All right, so first up, let's talk about what happens when the very blueprint of a tooth gets a little creative. We're talking about changes in shape, and some of these get really interesting.
So let's start with a classic case of looks can be deceiving. We've got two conditions here, gemination and fusion. Gemination, that's where a single tooth tries its best to split into two, but just doesn't quite make it. Fusion, on the other hand, is the total opposite. It's when two completely separate teeth decide to join forces and become one big tooth.
So how in the world does a dentist tell them apart? Well, it all comes down to a simple head count. With gemination, you still have the normal number of teeth in the mouth. One of them just looks extra wide. But with fusion, well, that's the big giveaway. Two teeth have literally become one. So if you count them up, you're going to be one tooth short. That's the crucial clue.
Okay, now for something a little different. Imagine a tooth is growing, everything's going perfectly straight, and then bam, some kind of trauma knocks it off course. That's what we call dilaceration, where the tooth is forced to keep growing but at this crazy sharp new angle.
And here is how it actually happens. An injury shoves the hard, already formed crown of the tooth out of place. But the soft part, the root, it isn't finished growing yet, so it just keeps on developing. But it has to do it from that new crooked position.
And just look at the results. You get these really dramatic, almost hook-like roots. It's wild to look at, but you can immediately see why this is a major headache for a dentist. What should be a routine extraction or a root canal, well, suddenly it's a really complex surgical puzzle.
All right, get ready for one of the most bizarre dental anomalies you'll probably ever see. It's often called dens in denti, which is Latin for, and I am not kidding, a tooth within a tooth. Its proper clinical name is dens invaginatus.
So what on earth is going on here? Well, during development, instead of growing outward like it's supposed to, a part of the tooth surface literally folds inwards on itself, creating this deep pocket. The best way to picture it is like taking a finger on a glove and pushing it inside out, back into the palm. That's basically what's happening inside the tooth.
And this isn't just some tiny pit either. It's actually classified into 3 different types, and it all depends on just how deep that inward fold goes. So type 1 is pretty mild, just a small fold in the crown. Type 2 goes a bit deeper, past the gum line, but type 3, that's the most extreme. It can create a channel that runs the entire length of the tooth.
And this right here is where things get really dangerous. Look at type 3. That internal tunnel basically creates a superhighway for bacteria. It gives them a direct VIP pass from your mouth straight into the deep tissues of your jaw, completely bypassing all the tooth's natural defenses. As you can imagine, the risk for a really severe infection is just through the roof.
Okay, so we've seen how a tooth's internal design can get all twisted up, but what if the tooth itself just gets lost? What happens when it follows the wrong map and ends up erupting in a completely unexpected place?
This is a condition called ectopia. And we're not just talking a little out of place. We mean the tooth gets truly lost on its journey and can pop up somewhere totally wild. We're talking places like the nasal cavity, inside the maxillary sinus, or even up near the eye socket. It's incredible.
Here's a great example. It's a bit less extreme than erupting in your nose, but you can clearly see what's going on. This canine tooth decided to come in way up high in the gum tissue, completely outside of where the dental arch is supposed to be.
Next up, we have transposition. Now, this isn't a case of a tooth getting lost and going on a solo adventure. This is more like two neighbors deciding to swap houses. They literally trade places in the lineup during development.
You can see it right here. The canine and the premolar have completely switched spots. And you can just imagine the kind of chaos this causes for a person's bite. It throws the alignment of all the other teeth completely out of whack.
So, we've talked shape, we've talked position, but there's another crucial piece of the puzzle, timing.
When a tooth decides to show up is also a very precisely programmed event. And, disturbances in that schedule are actually pretty common.
You basically see two sides of the coin here. On one hand, you have premature eruption. These are the teeth that are just way too early. This includes what we call natal teeth, which are teeth a baby's actually born with. And then, on the other end, you have delayed eruption, the teeth that are seriously late to the party. And one of the biggest reasons for a tooth being late is something called impaction. That's a word a lot of us have probably heard, especially when it comes to wisdom teeth. All it means is that the tooth is physically blocked. It just can't break through to where it's supposed to be.
And this right here shows you exactly what impacted can look like. The tooth might be tilted forward, lying completely sideways, or it might even be perfectly straight up and down, but just trapped by bone. Whatever the case, any of these situations can set off a whole chain reaction of problems. We're talking pain, infections, and even damage to the healthy teeth right next to it. Okay, so we've looked at all these different anomalies. Weird shapes, teeth in the wrong places, messed up timing. So what's the big picture here? What does all of this really tell us?
Well, what they really show us is that development isn't some rigid, straight line. It's more like an incredibly intricate dance, a mix of genetic instructions and environmental nudges. And every single one of these conditions we've talked about is just a variation on that theme, a slightly different outcome of that incredibly complex process.
And this is why it's so important to study them. By looking at these deviations from the quote-unquote normal path, scientists and doctors get a much deeper look into the fundamental rules of how our bodies are built. They're the exceptions that actually help us understand the rule.
And that leaves us with this final thought, doesn't it? Our bodies are not perfect machines. They're living records of an incredible developmental journey, filled with all these unique stories of resilience and variation. It really makes you wonder, if our teeth can tell us this much, what other stories are our bodies just waiting to tell? Thanks for joining us.